LSU Dental Health, and she will talk a little bit about the inequalities that we find in dental care access here in Louisiana. And I'll pass it to you, Valentina.
Hey everybody, my name is Valentina. I'm a third-year dental student at LSU. I'm also a volunteer at Luke's house, and I just find a lot of happiness and passion in sharing resources with people who are in need, or everybody in general who just sometimes don't know what's best for their teeth and where to find access to care. So I wanted to talk about dental care is the #1 health need, especially in New Orleans. This is proven among low-income children, older adults, and those with special care needs due to difficulty getting to an appointment or accessibility, rights, lack of insurance, etc. There is 1.8 million Louisiana residents that are underserved. And that is the amount of people that would fill the Superdome 23 times, to put it into perspective. So we find that less than 40% of children and adolescents from families with low incomes get preventive oral health services. Sometimes they wait until the problem has gotten out of control to reach help, which in this case is usually a very expensive or traumatic procedure. It's just always better to regularly go to make your children used to going to the dentist, and also to prevent large problems from happening. These problems keep people from going to work, affects their families, their income, and it affects society as a whole. For children enrolled in Medicaid, white children are more likely to have had a dental visit in the past 6 months than Black or Hispanic children. We don't want to see this differentiation between races.
Thank you so much, Valentina, for that information. And now I wanted to talk a little bit about Medicaid, access in Medicaid, and what Medicaid covers in regards to dental care and in general. And yeah, if you see the screen, you can see a table of basically what income levels would qualify you or would make you eligible for Medicaid. And especially if you lost your job due to the pandemic, we encourage you to call or to visit the Department of Health website to see if you're eligible for Medicaid. With Medicaid, you do get several different resources, including dental appointments to community clinics, and all the community clinics that we will be talking about and that our guests today do accept Medicaid and also have sliding scale prices for those who are uninsured. So with Medicaid, you do get free visits to the doctor, you get some mental health services, as well as vision services. And in regards to dental health specifically, it does include 2 cleanings a year, and as well as extractions and a couple other benefits. So we do encourage you, if you think you're eligible, do definitely call, visit the website to see if you're eligible to enroll in Medicaid. We will also be talking about resources like Crescent City Family Services that also help community members enroll in Medicaid. Remember that prevention is key. Don't wait until it gets worse, because it will get worse for your health, and it would get worse for your wallet. It will probably get more expensive as well. So it's so important to prevent. We also want to make aware that folks who are undocumented and who are pregnant can get enrolled in Medicaid. And this will last from the moment that their pregnancy is detected until they give birth. So anybody who is born in the United States is citizens, and they have a right to Medicaid, regardless of the immigration status of their parents. And there are also other government programs that you may be eligible for. And we're sharing the number for the Louisiana Department of Health if you'd like more information about that. Again, also, if you have different immigration status, you may be eligible for Medicaid. Do visit the website, call the number to get a little bit more information about that. After you lose Medicaid after pregnancy, this is something that we do a lot in our clinic. We connect people to community clinics that have usually a sliding scale, or there is a financial assistance program at UMC. And for dental care in general, most of the clinics do have sliding scale systems as well, which charge you depending on your income. And to apply for Medicaid, this also usually applies to sliding scale programs or financial assistance programs. You will need some documents. You will need a proof of address, which can be an energy or water bill that is recent. You will need a government ID. Usually places do accept IDs from other countries, especially passports. You will also need proof of income, which can be recent pay stubs or an official letter from your employer. Sometimes bank statements are accepted, or the taxes from last year. And also, if you have kids, and this is a service that's going to be for your kid, or even for you, sometimes they do ask for birth certificates. And as I said, many clinics have programs, either like a sliding scale program where they charge you depending on your income. UMC does have financial assistance, but it does not cover dental services. It covers mostly the other services, specialists and labs and all those kinds of services. And we will be hearing more from Crescent Care, from Excels, from LSU as well about their programs. As I said, almost the same thing as for Medicaid. They will require some type of official identification, proof of address, which is like a water bill or an energy bill that is recent, proof of income, pay stub, letter from employer, and birth certificates for children as well. Then that is it for me, but I will pass the microphone to Rachel, who will talk a little bit about United Healthcare Community Plan dental benefits.
Hey y'all, I want to personally thank each and every person who's taking their time tonight on Giving Tuesday to be on this call with us. Just a quick shout out, look at them, they're out here doing the work, sharing information on dental health with y'all and where to access food stamps and all kinds of healthy food. So these are amazing folks providing low-cost services in our community, and we're so grateful to be on the call with them. I work with United Healthcare. United Healthcare is one of 5 companies in Louisiana that offers Medicaid to the community. Medicaid is free health insurance for people with low income. And as you can see on the screen here on my right, kind of the income limit. So if you make below this amount, or you can go a little higher on the chart if you have kids, you qualify for Medicaid. If you've recently lost your job or had your hours reduced, if you meet the income guidelines in this chart, you may qualify. It doesn't matter if you just lost your job today. Call the Department of Health of Louisiana. You can reach them at 855-229-6848, or you can go online at healthy.la.gov. You have a right to health care regardless of your income. So take charge, sign up today. Also, just a shout out, it's open enrollment right now through August 15th. So if you have a certain Medicaid company, but you want to change, let's say you have a specialist or a therapist, a doctor that takes United Healthcare that you just love, you can switch, and you can switch from any company at any time during open enrollment. And this year we have an extended open enrollment because of the pandemic. So if you want to switch, United Healthcare is a great company. You can pick, and you can call 866-675-1607. United Healthcare's community plan includes unlimited visits to the doctor, totally free. You can also go to the dentist twice a year, as you should, as we're going to talk about on this call, the optometrist to get your glasses or your contact lenses, behavioral health. United Healthcare has excellent behavioral health care, so you can go to the therapist and take care of your mental health, which is always so important, but especially in 2020 and in 2021, it's been really important. You can get free rides to your appointments. That's actually true for all of Medicaid. You just call the number on the back of your card with a few days notice, and you can get free transportation to your doctor's visits. All of Medicaid includes low-cost medicines and so much more. In particular, at United Healthcare, we have free programs for smoking cessation that'll do wonders for your overall health and your teeth. You can get enrolled in Weight Watchers for free. We actually have telehealth and even telemental health offerings that you can do all from your phone. And we have wellness rewards. So you can actually get gift cards. You can get paid to go to the doctor and take care and take charge of your health. So if you switch to United Healthcare within the first 90 days of enrollment and you go to your primary care physician and you get a full health evaluation, you can get gift cards mailed to your house. We have a similar program for, if you're a pregnant mom, you're an expecting mom, you can get gift cards or diaper bags or fun things like that just for going to your prenatal visits, postpartum visits, for taking your child to the doctor. And we also have dental coverage. All Medicaid and United Healthcare includes dental coverage. So we really want to reinforce the rule of twos that you're going to hear some folks on this call talk about a little bit more, 222, which is remember to brush your teeth twice a day, 2 times a day for 2 minutes each time, and visit the dentist 2 times a year. And with United Healthcare, with your Medicaid coverage, you can go to the dentist twice a year. It's covered under your plan. It's free, so take advantage. An ounce of prevention is worth a pound of cure. Now, there's no excuse because you can get a free ride to get there. As part of Medicaid, as part of your benefits, you can get free transportation to all your appointments, your medical appointments, dental appointments, behavioral health appointments. You can get a free ride to get your COVID-19 vaccine or COVID-19 testing. So to do that, if you're a United Healthcare member, just call the number on the back of your card. It's 866-726-1472 to schedule a ride. Just with any plan, just call the number on the back of your card. Try and call 2 days ahead of time because they do require 2 days to set up that free transportation. And it's an excellent benefit. So without further ado, I'd love to pass the word back to our friends and colleagues at Excel.
Well, thank you so much, Rachel, for having us with the United Healthcare Dental Health Forum. We're excited to be here tonight. My name is Celeste Terry. I'm the dental hygienist with Excel, and we will be talking briefly on prevention and intervention in dental care. Along with me is our dental director, Dr. Douglas Cross, and our dental office manager, Kenyatta Anderson. So next slide, I'm going to get started. So this is me. I work for Excel as a hygienist. I've been with the company now for 9 years. I've been a hygienist for over 46 years. And of course, I love to talk to people about keeping their smiles healthy and bright. And tonight, that's basically what I'm going to be doing. Next slide. So tips for healthy smiles. It's very important what you do at home. It's very important to have a routine that's done on a regular basis at home. And the reason being, we have plaque and biofilm that must be removed each day to keep our gums healthy. And if we are doing that properly, we can have healthy gums for a long time and healthy teeth. So how do we do this? What should we be doing at home? Next slide. Well, to be honest, most of you probably already know this, brushing and flossing. When we brush, it's important to use a soft toothbrush. And like Rachel said, we should be brushing at least 2 minutes each time, morning and night, to remove the buildup of plaque and food and biofilm from our teeth. We should also be using a fluoride toothpaste with the accepted American Dental Association seal that shows that the toothpaste has the right amount of fluoride in it to do what it needs to do in terms of protecting the teeth from cavities. The other thing that's so key in keeping our gums and teeth healthy is flossing. And the reason we floss is when we brush, we're cleaning the three surfaces of the teeth, the cheek side, the tongue side, and the chewing surfaces. However, on the sides of the teeth, the brush is not going to reach there. So flossing is key for cleaning in between the teeth. And then finally, I like to recommend using a mouthwash to remove any plaque or biofilm that's in the mouth. And we can use antimicrobial rinses for that. And especially, I like to recommend using a fluoride mouth rinse to help strengthen the tooth enamel. So those are the two things that we could be doing at home on a regular basis. You're right, Rachel. So there are tips on how to brush and brush properly. We should be angling our toothbrush at a 45-degree angle between the teeth and gums. And then we will be using short back and forth strokes to clean the outer portion of the teeth near the cheek, as well as the inside near the tongue, and also the chewing surfaces. When we brush the inside of the upper and lower teeth, you want to use the toothbrush on a vertical or long ways, and again, the back and forth strokes to clean that area. And then to properly floss your teeth, I like to recommend using at least 18 inches. And to be honest, what I usually do is tear off the floss from the length of my wrist to my elbow, then wrap around the middle fingers. Use your index fingers and your thumbs to slide the dental floss gently in between the teeth, and then make a C shape. And that's going to remove the plaque that collects in between the teeth. And you don't want to forget to floss the back teeth. And it's also key when brushing and flossing to start in the back, do every tooth in that arch before jumping to the opposite arch. As we know, it takes about 2 weeks to develop a habit. So if we're routinely skipping the same teeth, it's likely we would have problems with those teeth. Next slide. So more preventive measures would include visiting the dentist on a regular basis for your dental exams and dental cleanings. And at those appointments, we can also apply in-office fluoride treatments, which will help to keep the teeth strong. And on children, it's usually recommended when the permanent teeth come into the mouth to put dental sealants on in order to prevent those teeth from becoming decayed. And school sealant programs are a great way to bring preventive care to students in school settings. So what are the things we can do to keep our smiles healthy? One thing that's very important is to eat healthy foods and to limit in between meal snacking. We want to avoid sugary foods and beverages, as well as foods that are high in carbohydrates. It's always a good thing to drink water as opposed to sugary beverages, and fluoridated tap water is preferred. We know that over 39% of our parishes have fluoridated water. So in those parishes, drinking tap water is going to be a big plus in keeping your smiles and your mouths healthy. So when it comes to water and sugary drinks, we know that there are lots of hidden sugars in beverages that we might think are healthy, such as flavored water or energy drinks. Some flavored milks even, and drinkable yogurt may be high in concentrations of sugar. So when we think about water, it's really a better choice. So the next couple of slides, we're going to talk a little bit about rethinking your drink and the reasons why. So here is a sugar coating on sports drinks. And as you would see in this diagram, the Gatorade is a larger container, and it has 600 milliliters of beverage in the bottle, and it also has 36 grams of sugar. And then this Coke can, which has 375 milliliters of liquid, has 40 grams of sugar. So it actually has more sugar than the sports drink. And oftentimes, we think that sports drinks are a healthier choice, but as you can see in this slide, you're consuming almost as much sugar in the Gatorade as you are in a Coke. And the next thing that when we do health fairs and when I talk to my patients, a lot of times we get into how do we know how much sugar is actually in a beverage? That gets down to reading labels. So the key thing is to look at the serving size of the container. And as you can see on this slide, the root beer has a serving size of six per this container. And then we drop down and look at sugars, which is also circled in green. And on the slide, it says that it has 45 grams of sugar. Now that's for one serving. So if we drank the whole bottle of root beer that has 6 servings in it, we're actually going to be consuming 45 grams of sugar at 6 times instead of 1, which is a huge amount of sugar. And then when we look at how much sugar is actually in a gram is 4 grams is equal to 1 teaspoon. So for 45 grams of sugar in this root beer, we're actually going to be consuming 11.25 teaspoons of sugar for one serving. So that would be 66 plus teaspoons of sugar if we consume the whole six servings of this bottle. And there's another example here that just basically says 4 grams of sugar is equal to 1 teaspoon. So we have a little bit of math calculating to do. So in a bottle of Sprite or a can of Sprite, that's a 12-ounce can, it has 33 grams of sugar. We divide that by 4 grams per teaspoon, we would be consuming 8.25 teaspoons of sugar for that one serving. So it's very important to think about what we're actually consuming, especially when some of these beverages may be high in sugar and we may not be aware of it. And as we'll hear from Dr. Cross later as to why that's important to limit our sugar intake. Next slide. So how often and how much are the key things that to consider when we're thinking about sugar? And we know that when we consume sugar, an acid is produced and an acid attack occurs for a period of 20 minutes. And so each time that we consume sugar or any acidic beverage, that acid is going to be in contact with the tooth a lot longer. So these are some things to consider when rethinking our drink. And of course, water is going to always be the best choice. Fluoridated water is the top best choice. So.
Hi, I'm Dr. Cross. I'm the dental director for Excel. I've been with Excel as long as Celeste, 9 years. So next slide. Celeste was talking about avoiding sugary foods and drinks. The reason you avoid that is because bacteria thrives on that sugar and it forms plaque on the teeth. And then when it gets sugar, it forms acids that break down the tooth enamel. So other ways of breaking down the tooth enamel include like heartburn or acid reflux, which stomach acids get in your mouth and also break down the enamel. It allows bacteria to get into the tooth. Dry mouth is another problem, particularly common in older adults. Other reasons you get more cavities is lack of fluoride. You should drink fluoridated water, but you should also use a good fluoride toothpaste and a mouth rinse as well. A lot of people say they brush their teeth, but they don't do a really good job. So you need to make sure you take the proper time, like 2 minutes at least, to brush all the surfaces of all your teeth. Next slide. So here's the stages, simply put, the stages of tooth decay. At one point, the decay is very small. And when it's small, it's easy to take care of, and fillings last a lot longer. When it gets more advanced, it gets in the dent layer, so you have larger fillings, which get more expensive and don't last as long. Then when it gets into the dent layer, you're going to definitely have some pain, some sensitivity usually to hot and cold. It doesn't last that long, but then it gets worse, because once it gets into the pulp of the tooth, then you have much more serious problems. In order to treat the tooth, you're probably going to need a root canal and a crown. This gets very expensive, and it's also very painful. So it's best to get the cavity when it's at stage 1. Cavities can occur in many places on the tooth, but the most common places is the grooves on the top of back teeth, between teeth, under old fillings. In fact, half the work that a dentist usually does is just replacing old restorations. Older adults are more prone to decay around the root surfaces. Next slide. So who gets tooth decay? Just about everybody. And the risk increases from people that eat sugary foods and drinks and high sugars. So people that drink bottled water or other water with fluoride helps protect the teeth, and they're less prone to decay. People that have dry mouths, a lot of that may be due to medications, also are more prone to decay. Some people are prone to weak enamel through genetics or childhood illness. And then, of course, people that don't brush properly and don't brush twice a day daily and floss are also much more prone to decay. And people who don't visit their dentist regularly. It's very important to visit the dentist regularly, because you can get problems taken care of before they get much worse. So it's cheaper, it's easier. So it's very important to visit your dentist. I'm going to discuss periodontal disease, and there's some patients who never have decay, and those people actually will lose their teeth earlier than people that have a lot of decay. The reason being is a lot of times people don't go to the dentist because they don't have any problems, or they don't think they have any problems, and they don't get their teeth cleaned regularly, and they don't realize they have periodontal disease. And periodontal disease doesn't hurt till it's too late. Next slide. So make sure you brush your teeth twice daily. Use a good fluoride toothpaste. Please don't go to maybe the Dollar Tree or someplace else and buy, inexpensive toothpaste, because Crest or Colgate, some of the other major brands, are not that expensive, and the fluoride can be more effective. Make sure the product, like mouth rinses, have the ADA seal of approval on it. One of the things you need to avoid, particularly, gosh, when it gets hot, people want to constantly sip drinks, and sugary drinks can be really disastrous to your dental health. I've seen many patients who've had incredible amount of problems who are very young, sometimes to the point where they have to have all their teeth extracted just because they're constantly sipping on Coke or something else every few minutes. So be very cautious about that. And, drink water, preferably water with fluoride, and make sure you see your dentist regularly. Next slide. So gum disease. Gum disease, it doesn't hurt until it's really too late. So you have to be very careful about that, and careful making sure you go to the dentist, even if you don't perceive you're having any problems. So what is periodontal disease? It's like it's an infection and inflammation that affects the bone and tissues that support the teeth. Healthy gums fit like a turtleneck sweater kind of around your tooth, tight, but when you get periodontal disease, the tissues get loose, and it affects the tissue that and bone that supports the teeth. Over time, teeth can actually fall out or have to be removed. So it's very important in treating early stages to prevent tooth loss. Next slide. So these are the stages of periodontal disease. So healthy gums, they're firm and they're pink. When you get the early stage of gum disease, gingivitis, your gums are going to be redder and they bleed very easily. Luckily, with gingivitis, this is reversible. You need to practice better oral hygiene. You need to get the tartar cleaned off at the dentist so it doesn't get worse and become mild periodontitis. Periodontitis is where you start losing the bone around the teeth. And then that can evolve into moderate periodontitis where you have more bone loss, and then severe periodontitis. When you get to those later stages, it gets much more expensive to treat your teeth, much harder. And you could have avoided all this just by getting to the dentist, getting your teeth cleaned, and practicing better oral hygiene. Next slide. So how do you know if you have gum disease? Well, if you have gums that bleed during flossing and brushing, that's not normal. Red, swollen, tender gums, that's also a sign of periodontal disease. And of course, gums that are pulled away from the teeth, bad breath that doesn't go away, pus between your teeth and gums, loose or separated teeth. And sometimes people have a problem with where the teeth fit together when they bite because the teeth are shifting. Also, a change in the fit of your partial dentures can also be a sign of periodontal disease. Next slide. So regular dental visits are very important for preventing gum disease. Also, they're important for checking for cavities and other oral diseases and conditions. Also, we check for signs of oral cancer, and then we remove the tartar. This is extremely important. You leave the tartar on, and every day it's causing more problems with your teeth. So it's also important in the foods that you eat, and also removing stains from the surfaces of your teeth that cannot be removed by regular toothbrushing and flossing. So we're able to clean that all off. And it's important to go to the dentist to learn how to care for your teeth. And of course, keeping your teeth and mouth healthy is important to protect the overall health of your body. That's it. So,
hello, everyone. My name is Kenyatta Anderson. I am the office manager here at Excel Dental. I've been with the company for about 8 years now, so I'm gonna give you guys a little bit of information and background on what we are and what we do and the services that we provide here at Excel. Next slide. So for dental, we do have 2 clinics that we offer our dental care at. One of them is on the West Bank at the Arthur Monday building in Algiers. And we have another one in New Orleans East off of Lake Forest and Reed, in which we provide dental care at these locations. Next slide. So with our Algiers location, we do offer services between 7 to 4, Monday through Friday. We have 2 doctors that are normal providers at this location, in which we offer exams, x-rays, checkups, cleanings, fillings, extractions, as well as partial dentures, full dentures, and occasional crowns. We do work on a sliding fee schedule, which is based on your household size and income. All you would need is proof of income, your photo ID, and proof of Medicaid or insurance if you do have that available. The contact number for that location is 504-302-9236. Again, this is the Algiers location off of Newton Street. Next slide. Here is the information on our New Orleans East location, in which we also share a facility with our medical providers. So at this location, we do the same services that we provide at Algiers location for dental, as well as our medical side for primary care and preventative services. We do offer other services outside of primary care and dental, such as behavioral health for adults as well as children. We have family planning services. We service patients for podiatry care as well as other social services care. Right now, we are providing COVID vaccine clinics at all of our medical facilities, actually. And we will be rolling out a mobile clinic as well for COVID vaccines within the near future. So this is just a list of all of the services that are provided at this location, including dental as well. Next slide. Here we have our mobile dental units, in which we use to service different community partners around the city. We do reach out to senior centers, schools. We do health fairs. We provide services to Head Start centers. And those services are not limited. It's pretty much almost the same services that you would get in the clinic, such as fill-ins, extractions. We're able to provide the normal care on the mobile unit, except we'll be coming to you instead of you trying to find a way to us. We'll come to you. If you know anyone who may be interested, or if you're a client at any facility that may be interested, the number is listed at the bottom, which is 504-620-0510. And we'll be happy to get you guys enrolled and get you guys serviced. Next slide. So our services are extremely low. So the initial visit is $50, which will get you an exam along with all of your x-rays. There's no additional charges for any additional x-rays that we have to take in order to diagnose your treatment. And it does come along with a treatment plan. So on your initial visit, we do ask that you bring your proof of income. That way we can give you those discounted fees the same day as your visit, so that you'll be aware of how much you'll need to pay. And you can kind of figure out what's more convenient for you as far as your income and what you're able to pay. We work with a sliding scale discount, which is based on household size and income. And we do accept most insurance plans, including all Medicaid, Medicare, and most commercials. Now, one more thing I did want to mention with the commercial insurance plans, a really good thing about us is being that we do work on that sliding fee schedule, we use that to kind of give you guys a better, I guess, I don't want to say deal, better option as far as getting your services at a reasonable price. So we use your copay based upon your insurance plans, and we would look at how much it would be based upon your income as opposed, and whichever is the better option, that is the price that you would end up ultimately paying for your fees of service. So if there are any questions, I am open to answering them at this moment.
We just want to give a shout out to anybody who's joining us over Facebook. Please comment on our pages and ask questions if you have any questions about dental health or anything we're discussing on the call. And please share with friends and family so we can spread the word about these great resources. Does anyone have a question from any of their pages? I know this video is being streamed on lots of our pages. If so, pop it in the chat, and if not, we'll just continue on with the forum and return to questions at the end. Thank you so much for our team from Excel.
Yes, thank you so much for all of that to Celeste and Dr. Cross and Kenyatta. We will continue now to pass the microphone to Dr. Jonathan Esquivel and Valentina Carrillo from LSU Dental Health, and they will be talking about some really, really important tips for our dental health.
Hey everyone again, I'm Valentina, third year dental student at LSU and volunteer at Luke's house. So I'm here to share information that I wish everyone knew, starting with that overall health is related to dentistry. There are several studies that show that there is a correlation between periodontal disease and heart disease, cancer, diabetes, stroke, and lung disease. The correlation has to do with the inflammation response that bacteria starts in our body. This is why it's so important to take care of our dental health as it affects the rest of our bodies. So the best way to care for our dental health is to prevent. It's important that we remember the rules of two that Rachel mentioned. It's important to floss daily and to avoid the excess of sugar. We must try also avoiding deleterious habits such as sucking on lemons, biting our nails, and chewing on ice. So, question, if I don't have insurance or I'm undocumented and my finances are limited, where can I access dental services? And one of the answers is LSU School of Dentistry. The cost is approximately 70% more affordable than private dental practices. The reason why that is, it's because it's us, the students, who do the work. It's a learning institution, even though we have faculty that guide every step and approve every step. We're learning, and so our patients pay us with their time. That's why it's a little cheaper. To make your first appointment, you need your date of birth, your cell phone number, and your full name. They don't ask to provide any more documentation than that. You're not asked proof of citizenship or residency to make an appointment. And of course, all are welcome. This is a flyer that I made when I began volunteering at Luke's house about a year and a half ago. And I put a lot of resources here. So some of them have already been on this call or will be, like Excel and Crescent Care. I put other options here as well as the basic concepts. Some other dental hygiene tips are like to remember to brush your tongue and to avoid smoking and avoiding soft drinks. And then I put here the address, hours, phone numbers, cost, treatment type. And so in case that you ever find yourself in a position where you need a dentist or your friends and family need a dentist, you could always refer back to this pamphlet for quick information, and you can screenshot it so you have it available. So on the next slide, we have some information just to be very transparent about cost and so that patients know exactly what they're getting into. I'm putting two options here. One of them is LSU School of Dentistry, where I'm a student at, and I write the prices. So for a new patient exam, it's $125. Depending on complexity, prices may change, whether it's undergrad who do the work like me, or whether it's residents who are already dentists and keep specializing. But for undergraduate, extractions cost $50, root canals cost $91, crowns $365, fillings range from $40 to $80 depending on how many surfaces of the tooth we're treating, and cleanings are $35. Also, I put here UMC, University Medical Center. This is where where we do rotations at for oral surgery. And this is a good place that patients can go when they need extractions, when they need to take a tooth out because the tooth cannot be restored. So complex ones, like wisdom teeth and hatchet teeth, then sometimes it's just better to do it under a hospital setting. Here, the consult is $20 and extractions are $45, and it will be the oral surgery residents who are doing this work. They have more experience. So on the next slide, I have another question. Can I use dental insurance at LSU? The answer is yes, but in some cases. So because LSU already has discounted prices, they don't they don't 100% take all insurances, but what I do know is that for private insurance, you can pay out of pocket whatever treatment you get, and then you can claim to your insurance for reimbursement. We also, I know for sure we do Medicaid and Medicare. For Medicaid, it's been covered already. So kids and adolescents get cleanings, exams, and x-rays. And for Medicare, I know that Medicare patients who need dentures can get a set of dentures 100% paid for under certain conditions, which I believe includes a denture every 5 years. And so now I want to pass it on to my mentor, Dr. Esquivel. He will explain the importance of trying to keep our natural dentition, as well as the options that patients have to replace missing teeth and why it's important to replace missing teeth. And we always want to say that everybody's welcome and that you will be in really good hands at LSU School of Dentistry. Thank you.
Thank you, Valentina. Thank you so much. Thank you, everybody, for being here. I'm Jonathan Esquivel. I'm a prosthodontist, and I am also a faculty at LSU School of Dentistry, where we have great students like Valentina and all of her classmates. And one of the main focuses of our school is to be able to serve the community of New Orleans and also the state of Louisiana with good dental care at reasonable prices, actually pretty good prices compared to what they would be in a private practice setting. And the important thing, though, is that regardless of the fact that the price is a little lower, the quality of work that our students do is pretty good. Like Valentina says, yes, it takes a little bit more time, and our students are in constant evolution in their knowledge base, right? But they do a fantastic job. And I want to focus a little bit for a few minutes today of the importance of keeping teeth. I know Dr. Cross went over it very well, but I'm going to look at it from the other side. I want to talk about what happens when you lose a tooth, because that's another important consideration that we must understand. Oftentimes we say, well, I just can't afford to do a root canal. I cannot afford to do periodontal surgery. I cannot afford to get a crown. And then we start falling into a series of problems that are going to lead to more expensive treatment, but not only that, but to also physical changes that are associated with tooth loss. Okay, so my first advice here is, yes, definitely prevention is the number one thing, and trying to keep our teeth is the most important thing. So oftentimes we have to invest a little bit on this teeth to repair them, but to try to keep them in the mouth, because the moment we start losing teeth, we start affecting the position of neighboring teeth, okay? Because teeth tend to drift, or that are left in the mouth, drift into spaces of non-existing teeth, or we have super eruptions of the dentition opposing the tooth that has been extracted. You start losing phonetic skills, especially if it's teeth in the anterior part of the mouth, then you're not gonna speak right. And of course, understanding that teeth are part of our digestive system because they are in the mouth, right? We're gonna start having eating problems. So the way that we're gonna process our foods are not gonna be in the ideal way or the ideal condition to go down into our digestive system, which may lead to problems down the road. And of course, definitely, aesthetics is gonna play a key role, because the moment we start losing teeth, our facial structures start changing. We start losing what we call lip support. So our lips don't look so filled, okay? And we have that appearance as if we're a little bit older in age. But this is very simple for us to be able to restore and repair. The idea is not to get to this point, though. It's not to get to where we have to restore the whole mouth, and hopefully tackle this before it becomes a serious problem. Okay, but yes, can we fix this? Yes, we can restore smiles, we can restore facial appearance with, of course, a different type of prosthetics. So in a nutshell, we understand what happens when we lose a tooth. Bone starts resorbing, teeth start shifting, we start having eating problems, we have start having problems with phonetics, we start losing other teeth, and there's ways to treat them. There's ways to treat this missing tooth. Okay, we can do it with a fixed prosthesis, what is commonly known as a bridge. this is one of the options that our students are able to do, and we're able to serve you with. The second option is when it's multiple teeth, we can do something that is called an RPD, a removable partial denture. Okay, this prosthesis will allow us to restore multiple teeth at the same time, and its cost is fairly economical. Okay, the only issues here, of course, you're going to have to be putting something in and out of your mouth. Now, this prosthesis can always be a complete denture if all your teeth are missing in the mouth. And the other option we have to restore one or multiple teeth are dental implants. Okay, so I'm just going to pass you a little image of what a FPD or a bridge looks like to replace one tooth. Okay, the two abutments, which we call, are holding that bridge together. Those two abutments are going to be on top of teeth that we have prepared, that our students have prepared. And then the middle tooth, which is the one that is missing, is going to be restored with a Pontic. Okay, which it's going to help you get back your function. The other option, like I said, to restore a single tooth or multiple teeth is, of course, with a dental implant. And a dental implant, we're going to put a tiny little screw inside your bone, okay? And then we're going to connect a tooth on top of it, and it's going to restore the way you function or the way that you were able to eat before. Okay, so there's many ways. What we don't want to get to is we don't want to get to the situation where we have to lose our teeth, because even though we can restore some function and we can restore aesthetics with a complete denture or a removable partial denture, it's never the same to have your natural dentition than to have something that is not naturally yours, and it's just there to try to give us some efficiency while we eat. And the truth of the matter is that even though they're very good, they're never going to be the same as if we had our teeth. So, of course, an ounce of prevention is worth more than anything. Just prevent. That's the message here. And there's nothing like your roots in your bone, your tooth in your mouth. But if you have to lose a tooth, we need to replace it. Okay, don't forget this, because oftentimes we say, I just don't want to do it right now, like I said in the beginning of my few minutes, because I can't afford it. Well, it's going to become more and more expensive as time passes by. So thank you so much for your kind attention, and I'll have pass the microphone off to Edith, I guess, so she can have this next speaker. Thank you.
Thank you so much, Dr. Esquivel and Valentina, for that super important information about our dental health. And now we're going to move on and to Mr. Reginald Vicks from Crescent Care Dental Services, who will talk a little bit about Crescent Care.
Thank you, Edith. Good evening, everyone. My name is Reginald Vicks, and I'm the Chief Operations Officer at Crescent Care. Crescent Care provides a full array of services, including dental services, primary care, family and pediatric care, obstetrics and gynecology services, wellness and healthy living initiatives, psychiatric care, behavioral health, and dental services. We are a federally qualified health center, and we provide primary care to over 13,000 patients at 2 clinic locations here in New Orleans. So Crescent Care uses a holistic one-stop shop of wraparound services in all of its programs to hopefully positively impact the social determinants of health for our community. Majority of our patients are male, African American, and most have very low incomes, below 100% of the federal poverty level, sorry. And approximately 25% of our clients are individuals living with HIV. And we serve all individuals regardless of their ability to pay. So Crescent Care began around 1983, 1984, and we built a large clinic in the St. Roch community at 1631 Elysian Fields, and we also have another clinic at 3308 Tulane Avenue. Our clinic at Tulane Avenue is where dental clinic resides. It's co-located with our primary care services, and we also offer the same array of services that was just discussed at both sites. So people living with HIV are eligible to qualify for Ryan White program funding. We also have an FQHC sliding fee scale, and we provide case management support for all of our clients. So even if you're coming to the dental clinic, you can still avail yourself of all these services. One thing that we do for all clients, if you're eligible for Medicaid, we provide supportive enrollment services, which will help you access all of the other wraparound services to support a more holistic approach. Our dental clinic is primarily, as I said, located at 3308 Tulane Avenue, and it's a general dentistry practice. So we provide the same array of services that have been discussed previously: restorative, extractions, preventive dental services, etc. So we definitely want to make sure that clients in the community understand that we're open. We don't turn anyone away. Our sliding fee scale is available for anyone who would need it, and we will work with you to support payment plans if you're unable to fully pay for your services. Next slide. So call our main number and request a dental appointment. We also treat emergencies. We usually work those into the regular schedule. So please take care of your dental health. It will affect your overall health in a very positive way. And I'm happy to answer any questions once we get to the end of the presentation.
Thank you so much, Mr. Reginald Vicks, and for that information about Crescent Care. It's really important to know that we have this resource and this community clinic available as well. Now we will move on to talk a little bit about pediatric dental care with Dr. Suzanne Fournier.
Hi, thank you for having me. I am a pediatric dentist at Children's Hospital in Uptown by Audubon Park. Thank you for giving us this opportunity. We are undergoing some transformations on our campus. So next slide, please. So if you haven't been there in a while, it is looking a little bit more like this picture and should be opening up that front concourse soon. But there's lots of changes going on inside. But one of the biggest things, next slide, please, is that Children's Hospital is really committed to addressing oral health equity concerns. So we want to make sure that we can take care of all kids regardless of the type of insurance that they have, if they have insurance at all, but especially if they have any systemic concerns or special health care needs. We really want to try to make sure that we provide quality care for everybody, regardless of those concerns. So there's just a little bit of background about me, but I am a full-time pediatric dentist at Children's Hospital. And I know we talked a lot about what Medicaid would cover for adults, but Medicaid covers almost everything that kids could possibly need. The only exception would be potentially braces, but they actually do cover that for kids with cleft lip and palate and other craniofacial anomalies. So we really are trying to address all concerns with oral health for children, and we're lucky that Medicaid does support that. So next slide. So we are accepting new patients at Children's Hospital, and we want to be able to provide a dental home as well as a medical home. If you're interested in getting an appointment with me, this is our phone number, it would be option 1. And what are those potential dental services? Again, regardless of type of insurance or lack of insurance, we do provide preventive care such as cleanings, exams, x-rays, fluoride, sealants, as well as all restorative care, fillings, crowns, extractions, baby tooth root canals, behavior management, including comprehensive treatment under general anesthesia. And as I mentioned, oral health care. We also have a fantastic oral surgeon on staff with us who takes care of everything from oral pathologies to wisdom teeth extractions and everything in between. So I know you've all heard a lot about the impact of oral health. I wanted to specifically address the impact of diet on oral health. I know Dr. Cross did a great job talking about caries and cavities, how people get cavities. I wanted to touch base on that just a little bit more specifically now, if that's possible. So one of the things that I think is the most important way to first address talking about cavities is that it is actually considered an infectious disease. And for me, we actually call it caries in dental terms. Caries is a dynamic process, and it's basically the result of, you need 3 things. You need teeth, which as dentists, we like to try and save teeth. You need to have bacteria, and those bacteria spread typically from parent to child. So oftentimes parents will come in saying, well, I know that it's genetic. Well, it's not really genetic. It's actually that the bacteria spread through saliva contact. So kissing on the lips with babies, sharing drinks, sharing spoons, blowing on food to cool things off. That's how kids initially get infected with bacteria. And then the last thing you need is carbohydrates. And it's not so much how much sugar, but it's the frequency of sugar consumption that causes cavities. And as you can see in this picture that just popped up, anytime you eat or drink something with sugar in it, the pH, which levels acidity, will drop. So that means acid level goes up. And in general, our bodies need about 2 to 3 hours to flush away all of the acids that the bacteria make. And if you're constantly sipping on, say if you're a kid, juice with a sippy cup, you take a sip, you put it down, you go play, you come back, you take a sip, you put it down, you go play, you come back every 20 minutes or so, then that's bathing our teeth in sugars and acids, not giving our bodies the time it needs to flush away the acids with just saliva production. And so that's going to promote cavity formation. Also eating lots of things like crackers and chips. It's not just candies. And they get stuck in the groovy parts of your teeth and will cause cavities, just like Dr. Cross talked about. All right. So when we talk about diet counseling, especially related to kids, we really encourage establishing a dental home by age 1 or when the first tooth erupts. If it's sooner, then that works great too. And the reason why is because we want to talk a lot about prevention. It's a whole lot easier, like everybody else has talked about, to prevent problems than it is to have to treat them once they're already there. So as you can see in this picture, when babies go to bed with a bottle, infantile swallowing is very much dependent on the tongue thrusting forward and backwards. And when a baby goes to sleep with a bottle, the tongue stays behind those front teeth and it'll trap the sugars from the milk behind the front teeth, and cavities will start there. Oftentimes we can't see them until the cavities are so big that they start wrapping around to the front of the teeth. And that's when parents can actually start seeing them and are aware that there's a problem. So we typically recommend weaning from the bottle between 12 and 18 months of age, but actually limiting at-will feedings at night when the first tooth erupts. For toddlers and school-age children, we really want to avoid eating those complex carbohydrates like crackers, chips, dried cereals once the back molars come in, because they do have deep grooves. And we really want to encourage eating fresh fruits, specifically the dark red blue skin fruits, things like apples, blueberries, strawberries, raspberries, cherries are really good for our teeth. Any kind of fresh raw vegetables are fantastic. Cheese, yogurt, nuts, beans, eggs, again, anything that's going to be more protein based. Proteins are also going to help extend blood sugar level a bit longer, so that way you're not going to feel that need to snack as often. And just like Valentina already mentioned, that there's a lot of connections between oral health and systemic general health. This also will help prevent concerns like childhood obesity and type 2 diabetes. All right. And as Celeste already mentioned, we always recommend drinking of fluoridated water. We really encourage drinking city water here in New Orleans is fantastic. There are areas in the outside areas around New Orleans, so getting closer to Baton Rouge, that do not have water that is fluoridated, but you can always look that up on the state health department website. Another great way to get fluoride, which is, we just consider it more minerals to keep the teeth stronger and more resistant to the acid insult, is with toothpaste. And for kids under 2, we recommend a smear that's also kind of like a grain of rice size. And then older kids can get a pea-size amount of toothpaste. And the most important thing is to try and increase the amount of time that the fluoride is touching teeth. So that's why we make the recommendation of after brushing to spit out the toothpaste, but do not rinse with water afterwards, or even a mouth rinse. Now you can rinse before brushing, but typically after brushing, we want to make sure that the toothpaste is the last thing that touches teeth, especially before bed. This just goes into the importance of fluoridated water. I think we've already kind of addressed this, but I also wanted to touch base on Children's Hospital has launched an initiative called Thrive Kids, and we really want to be supportive of our community and specifically our students in the area and the schools. And so this is just a little bit of information on this program called Thrive Kids. You'll probably be hearing more about it coming up soon. And we also are working through Thrive Kids to help with school-based virtual care and being a resource for educators within the state, as well as school nurses, and talking about different ways to help with dental traumas. If kids on the soccer field and avulses a tooth, then what do you do? Well, we can help provide support with that. And we have a designated nurse hotline, but if again there's a dental trauma, we're always here to help. So thank you all so much. If y'all have any questions for either the dentist or Thrive Kids, here's some information. We do have people at Children's Hospital who are available to help if you need help signing up for Medicaid or accessing other resources that the hospital has available. We are here for you and all of your oral health needs for kids under the age of 21. Thanks.
Thank you so much, Dr. Fournier, for informing us on pediatric dental care and Children's Hospital. And we're gonna move on to Liz from Crescent City Family Services, and she's gonna talk about all the very necessary, important services that they provide for our community.
All right, good afternoon or good evening, everyone. Thank you so much to Rachel and the United team for having us on the call. It's been very, very great to listen about all the wealth of knowledge from the different physicians about how important healthy teeth and beautiful smiles are, and how definitely nutrition can play a portion and a role in that. So we go on to the next slide. I'm going to tell you a little bit about Crescent City Family Services. So on this slide right here, yeah, you can say right there. We have our president and CEO, Miss Mary Schultheis, and our mission and vision. And it's because of Miss Mary Schultheis that we are able to really offer the services. She has such a way with being creative and just making these different platforms and opportunities for us to be able to share education with our clients. So when we're talking about healthy teeth and beautiful smiles, WIC services definitely plays a role in that because of the nutritional aspect of it. So WIC is the Nutritional Supplemental Food Program for women, infant, and children. All people that are eligible are going to be women who are pregnant or postpartum and breastfeeding, infants and children up to age 5. Next slide. All right, so who's eligible? Categorically, as we just stated, it is women, postpartum women who have just given birth, and then also breastfeeding moms, infants up to their first birthday, and then children up to their 5th birthday. Also, residentially, they do have to be a resident of the state of Louisiana for us to be able to service them. It is income-based, and you would have to fall below the 185% in the U.S. poverty income guidelines. Also, based upon your nutrition risk, so height, weight, growth assessment, hemoglobin levels as well. So what are some of the WIC health outcomes? It helps to reduce premature births, reduce fetal and infant deaths, reduce incidence of low iron and anemia. And because we are promoting those healthy food items and options, it definitely does play a role in, your teeth and the way that they grow. And we've kind of heard some of that from the physicians that are on the line today too. So also here at Crescent City Family Services, the other umbrella that we have under our organization is our Healthy Start program, in which we focus on infant and maternal mortality and basically how we can lower that in Jefferson Parish. You can go ahead on to the next slide. And we also have the additional programs under Healthy Start, which include our case management, our parent education, our 504 Dads program, which is our dads support group. Also, we have our parent reward program, in which we reward the parents for making good choices, going to their WIC appointments, going to their doctor's appointments, going to their dental appointments, and really just achieving goals that we set in place. And then also, we have our Community Action Network, and Rachel is a member of our Community Action Network. And it's basically a network of our community partners in which we all come together and talk about our common goals and how we all can play a role in helping to advance our clients and their way of life. Next slide. Alrighty, so now we're going to get into supportive services, and this is the way that Crescent City kind of fits into this entire presentation. So with our supportive services, we have our diaper bank and our food pantry. So we're able to service our clients and kind of break some of the barriers that they may be facing. And with the food pantry, we do receive food from Second Harvest Food Bank, which are all healthy and nutritional options. Also, we have our community classes, which is the Let's Talk Tuesday and the Centering for Pregnancy. But what we're here to really promote today is the way that we're able to help bridge the gap on what we're talking about today, which is our Medicaid and our food stamp program. So with our Medicaid application and our food stamp application assistance, we actually have team members on site that help clients to complete these applications. They help them to kind of navigate, and sometimes it is a little bit harder because right now everything is electronic. But whenever a client is able to get Medicaid, they then have access to be able to go to a dentist. Also, with the food stamp process, they're able to go and pick out healthier food choices that can also promote good dental health as well. Alrighty, so these are our points of contact. Now we have our WIC coordinator, which is Ms. Courtney Martin. We have our program manager, which is Ms. Kathy Morris, myself. I'm the operations manager, and I also oversee all of our community service projects. So if anybody is looking to partner with us, or if you're looking just for some more information on our supportive services, I would be the contact for that. And then with fatherhood, we do have our fatherhood coordinator, Mr. Daryl Greasy. And at this time, if anybody has any questions, and just to let everyone know, if you are in need of a Medicaid or food stamp application assistance, you can always reach out to us. Here's our contact information right here. You can follow us on our social media platforms, which are Instagram and Facebook. We also have our website there. So if you want to reach out to us there so that you're able to complete a referral, but you can always call our main office and ask for assistance with supportive services. And then these are all the lists of services that we do offer here at Crescent City Family Services. So we do have the WIC program, all of the Healthy Start services. So like we stated, case management, the 504 Dads program, Community Action Network. We also have community classes, Medicaid enrollment, food stamp enrollment, the diaper bank, the food pantry, and we're actually getting 2 of our team members certified in car seat safety. So we'll be starting that up very, very soon. These are our flyers that kind of give the information on our food pantry. So it tells you how you can request the food and complete the the food pantry application, and then also the days and times to pick up. Also for our diaper bank, we do the first Monday and Tuesday of each month. So yesterday and today we had our diaper bank. So these are completely free diapers to anyone. So if you know anyone that is in need of diapers, please make sure that you send them to our office on the first Monday and Tuesday of each month. Our next one will be on June 7th and 8th. All righty. Thank you so much, everyone. Again, thank you, Rachel, for having us on the call. And we're definitely here to help anytime. So please feel free to reach out.
Thank you so much, Liz, for that important information on Crescent City Family Services. And now I'm gonna pass the microphone to Rosalind Santos from Top Box Foods.
Thank you. Hi. Thanks so much to UHC and Rachel for having me, and happy Givnola Day to everyone. My name's Rosalind. I am the marketing associate for Top Box Foods Louisiana, and I am going to talk with everyone today about what we do and how you can jumpstart your healthy dental habits with by gaining access to fresh fruits and vegetables with some of our programs. Top Box is a nonprofit here in Louisiana that delivers boxes of fresh groceries contact-free in New Orleans and in Baton Rouge. We've seen that healthy eating can obviously significantly help you maintain or improve your dental health. And we have a program that makes that really easy to get access to those groceries. That program is called the Making Groceries Program. And what that does is it delivers fresh fruits and vegetables for up to 40% off standard retail, delivered right to your door. Specifically, we deliver the produce, but we also deliver meat, seafood, poultry items right to your door daily if you're in New Orleans, and then twice a week if you are in Baton Rouge. Customers can pay with credit, debit, and EBT on all of our boxes, including our local offerings, which are the Crescent City Farmers Market box and the Recirculating Farms bag. And the way it works is New Orleans can place orders Sunday through Thursday by 8 p.m. to guarantee delivery the next day when you're within our delivery zone. And in Baton Rouge, orders can be placed by 8 p.m. on Tuesday to get it Wednesday, and 8 p.m. on Thursday to get it Friday. And to order, it's really simple. You can just visit our website, topboxfoods.com, or you can call the number on that previous slide. It's all on our website as well. We can head to the next slide. So we have a few grant funded programs happening right now for those paying with EBT and SNAP. The first one is in New Orleans. It's called Market Match. And this is aimed at encouraging our customers to consume more fruits and vegetables. So customers paying with EBT can receive up to 50% off their order, specifically 50% off their order if there's all produce items in one order, and those also apply to the Crescent City Farmers Market box and the Recirculating Farm bag. And then our customers can also get a dollar for dollar match on meat, poultry, seafood items towards the box of produce that they add to that order. And then in Baton Rouge, the next slide, thank you. Thanks to Capital Area United Way, we are offering a flat 50% off of your entire grocery order when you pay with EBT. Next. So we're super excited. Right now we've got a new website, and we are exploring, putting local food items on there, especially in New Orleans. This kind of allows us to further invest in local food and vendors, farmers, growers in our state. And then this website will also offer in the future local options in Baton Rouge as well. Next slide. So in order to be eligible to receive a box, you just have to be in our delivery zone. And that means having a delivery address, whether it's yours, or your friends, your work address, your parents' address, someone's address that we would be delivering to within this green circle we've got going here. And if you don't quite fit in the zone, you can give us a call and we can see what we can do. Alternatively, if you aren't in our zone, you can pick up at our office, which is the Liberty's Kitchen office at 300 North Broad on Tuesdays and Fridays. And you'll be able to see that when you go to our website and check out, you'll be able to select your delivery or pickup options. And that next slide is going to be your Baton Rouge delivery zone as well. Okay, so next slide. So right now, thanks to the team over at UHC, you will get a free dental kit when you purchase using your EBT card, and that is while supplies last. So hopefully we can keep that going for a little while longer. Next slide. Awesome. So if you have questions, you can call me directly. That is my number, 504-408-0638. And that is my personal email and then our general email. Finally, a small Give NOLA shout out to all of the nonprofits on here. We highly encourage everybody, taking a moment to look at Give NOLA pages today if you're in a position to help out and spread the awareness around the city today. That is our specific Give NOLA page if you would like to check it out. Thank you so much.
Thank you so much, Rosalind. And yeah, we encourage everyone to take a look at the services from Topbox. They have some amazing programs. And also, yes, definitely, it's Give NOLA Day. So check out the pages for all our different organizations today. And if you can make a gift or a donation, be greatly appreciated. And now we are moving on to Sophie from Recirculating Farms Coalition, who will talk about their programs.
All right. Hello, everyone. So I'm here with Recirculating Farms because Edith and Rachel thought it would be important to include some orgs that focus on accessing healthy food so that we can keep our teeth clean. And anyhow, we intervene at every step in the farm to table process at the local, regional, and federal levels. We focus on hydroponic and aquaponic growing and regularly offer trainings to beginning farmers. In case any of y'all are interested in operating a greenhouse, raising chickens, beekeeping, composting, etc., we'll be hosting some in-person and virtual classes on topics such as those during the remainder of the spring and well into the summer. We also occasionally help folks create their own gardens. So if that interests you, you can reach out, and I put my email on that first slide. Ultimately, the goal is to help folks grow their own healthy food and take ownership of growing spaces. And on this slide, now we see that there's a couple resources related to food access in the city. So the Louisiana Budget Project created this awesome resource. It's a SNAP screener, and it can help people determine if they may be SNAP eligible. And if you just go to that link, you'll be able to go through it yourself or for a friend. And then the Food Policy Advisory Committee has a bunch of resources available surrounding food assistance. And all these resources are available in Spanish as well. And they have a specific line for seniors looking for food, which is 504-345-8437. And that's open from 9 to 11 on Mondays and Tuesdays through Fridays from 12 to 2 p.m. Next slide, please. So here's a picture of a bunch of vendors at the Refresh Market. Our goal is to eventually have SNAP assisters at the market. So then people can bring their paperwork and IDs directly to us, and we'd be able to apply with them on site. And when this gets rolling, we're gonna need volunteers. So if you're interested, yes, Rachel? Oh, you're interested. Okay, yeah, got it. So when this gets rolling, if you're interested, please send me an email and I will keep you updated on our progress. And this market is from 3 to 6 p.m. at 2606 St. Louis, just off the Lafitte Greenway, around the corner from Hay Coffee. Next slide, please. So as Rosalind mentioned with Topbox, there is unlimited market match. And this is through the Market Umbrella program, which is supported by the USDA's Nutrition Incentive Program, and our Growing Local bag, which has produce sourced from our farm in Central City, as well as other local farms, is offered at 50% off for people using EBT through this program. And then as it relates to markets, you're met halfway by matching SNAP purchase, or by the matching of SNAP purchase dollar for dollar when you buy fruits, veggies, and food-bearing plants. Another incentive program at the Refresh Market is through the Friends of Lafitte Greenway. And so if you attend just 3 free classes, which are offered on Mondays, Wednesdays, Thursdays, and Saturdays, you get $20 to either the Refresh Market or the Crescent City Farmers Market. And they have a wide range of classes from yoga to hip hop cardio to hip hop kickboxing, bodyweight boot camp. It's very fun and free money. And another program that the Refresh Market also offers is through the New Orleans Complete Streets Coalition. And they give any people that come to the market $2 off for biking, walking, or taking public transportation. And most recently, the American Heart Association has been coming to the market, and they offer $8 off if you just take a food insecurity screening, or they'll be offering free food or plants if you just stop by their table and learn more about heart health. And so we hope that you come visit us at the Refresh Market and that you take advantage of the unlimited market match available through the end of June. Thank you.
Thank you so much, Sophie. Those are great programs. I'm sorry, one moment. Rachel, if you'd like to take over, I'm having some difficulties at the moment.
Absolutely. We are just so thrilled with everyone who's been on this call tonight. Thank you so much for joining us, and incredible resources. We are so grateful to each and every organization who has joined this call. Y'all, it's Giving Tuesday, Give NOLA Tuesday. If you're looking to support some organizations doing some fabulous work, look no further. All of these clinics are taking time after their busy day of work, to be out here sharing with us all, about how to keep our teeth healthy, how to prevent, dental and gum disease, where to access healthy food. So we just want to give a huge shout out and thank you to Children's Hospital of New Orleans, Crescent City Family Services, Excel, LSU School of Dentistry. I'm here with United Healthcare, Recirculating Farms, who just shared, Top Box Foods, Crescent Care, and Luke's House. So we are just so grateful. If you are looking for where to get low-cost dental, services, whether you have Medicaid or whether you're uninsured, if you're looking for where to get help enrolling in Medicaid or where to get help enrolling in food stamps so that you can eat that healthy food instead of those sugary drinks like we learned tonight, you have some resources. So please, y'all, if you have any questions, please share it in the chat here below this video. And if we don't reach you now with your live questions, we'll definitely be following up. So please look out for these great clinics and resources in our community. Does anybody have a question from their Facebook page that they wanted to share with our team? Those of you who are tuning in, please like and share. Please comment. We are here for you. And if there are no other questions, we just want to say thank you so much to this incredible team who joined us this evening. And we hope you all have a wonderful evening and week, and brush your teeth twice a day. All right, everybody, thank you so very much. Bye.